Good afternoon, everyone. This week, good progress was made in Grey Bruce in the fight against COVID. There were 61 new cases this week, down from 120 a week ago. On July 29th, the Grey Bruce Health Unit announced that Grey Bruce is no longer a provincially designated COVID-19 hotspot. Cases in Ontario rose slightly, and today Ontario recorded 218 cases, the highest daily total since July 1st. One resident of Grey Bruce died of COVID during the last week. This brings the number of deaths over the last month to 11. Currently, there are no active cases in the Blue Mountains. The Grey Bruce Health Unit stated that if the weekly pattern of new cases continues to decrease or remains stable through the coming long weekend, we will be in a good position to move to a full step 3. Until then, the Grey Bruce Health Unit is asking the public in Grey Bruce to stay the course with modified step 3 protocols, which include a strong recommendation that gatherings be limited to a maximum of 25 people outdoors and 5 indoors. Additional recommendations for the modified step 3 in Grey Bruce include strong encouragement to dine only outdoors, follow all public health measures, especially in gyms, cinemas, and fast food locations, and at church services, and especially at wedding receptions and other social gatherings, and to wear masks in all personal service settings and salons as required in step 2. The recent deaths and cases in Grey Bruce are proof how extremely efficient and effective the Delta variant is at transmitting and at causing severe disease, leading to hospitalizations and even death. The local experience is being repeated in many places in the United States and throughout the world. The Grey Bruce Health Unit has completed a detailed analysis of the recent surge in Delta variant cases and reports that robust case and contact management was crucial in bringing this latest Delta variant surge under control. However, as the majority of transmission, over 95%, was in individuals who were not fully vaccinated, an aggressive rollout of vaccine is indispensable to ensure that it does not happen again. This analysis also identified that the majority of transmission was in individuals who were not fully vaccinated. The main drivers of the outbreak were private gatherings and parties, transient populations and low economic status and crowded housing, a high number of high-risk contacts. There was no increased risk of transmission in workplaces and other regulated settings. Without question, the analysis showed that vaccination is the only way out of this pandemic. While previous projections showed that 75% vaccinated would be sufficient to reach herd immunity, with the more contagious Delta variant now being the dominant variant, we need to reach a higher vaccine target of 90% coverage. Therefore, the Grey Bruce Health Unit is ramping up the targeted vaccination strategy by adding more pop-up and drive-through clinics. We need everyone's help to encourage those who have not yet had their vaccine to get protected. Having everyone who is eligible fully vaccinated is the most successful way to prevent COVID-19. There are drop-in vaccine clinics every day in Grey Bruce. Locally, there are a number of vaccination clinics planned next week in the town of the Blue Mountains. Information on clinic times can be found and appointments made at the tbmvaccines.ca website. Information on these and other clinics in Grey Bruce can be found on the Grey Bruce Health Unit website. If you have not yet been vaccinated, please go out and get vaccinated as soon as possible. Vaccines are the best way to fight COVID. There is absolutely no need for you to be the next person in Grey Bruce to get sick and die of COVID. No double vaccinated person has died of COVID in Grey Bruce. Have a great weekend. Get vaccinated if you haven't already done so, and stay safe.